to our next segment on mind-body practices for endometriosis. I'm Deborah, this is Wendy. We're here from Living Lēla, and we are the co-creators of a program called Soulful Conceptions, which is a complete mind-body fertility program. And we specialize basically in mama making, not just baby making. We want to help optimize your fertility naturally.
Yes, and so today we want to introduce you to the Fertility Ball Method and how it may be used to help with myofascial release to help reduce pain associated with endometriosis. And this myofascial release, some of the areas that we target with the Fertility Ball Method specifically are the torso, the ovaries, the pelvic floor, the diaphragm, kind of that whole general pelvic region and torso area that can be affected. So
what is your fascia, you may be asking? Well, I want you to think of, but your fascia is connective tissue. And basically it runs throughout your whole body, connecting everything together. So there's two kind of metaphors or pictures that I was taught that I think help to illustrate it really well. So the first one I want you to think about is a sausage link. So if you have a string of sausages together, the fascia is the outer part of the sausage. The inner part is your muscles. So if you actually did a dissection of the body, most people don't realize, you would get this string of muscles and other tissues that are all connected to one another. Nothing is separate from anything else in essence. The other picture that you can think of that I also really like is that of an orange. So the skin of the orange is fascia, and then all of those little segmental pieces that separate the inner pieces are fascia as well. So basically you have fascia that runs throughout your body like that, basically connecting one thing to the other. So then what is myofascial release? Well, it's the idea of slowly, not always slowly, but stretching your fascia so that your all of these trains of tissue that run together slowly open up. You become more flexible, your circulation gets better. It basically helps with pain, all kinds of things. Now, important for you to know, we are not myofascial specialists or therapists per se. There are people who specialize in that, where you actually go for a therapy session and they will use their techniques of various sorts to help release the myofascial tissue in your body. But we do, through our fertility ball, we're able to target some of that. And we focus, of course, particularly on the pelvic area where your reproductive organs are.
Absolutely.
Yeah.
And so we're going to demo two different things today using the Fertility Ball Method. And this is just a couple of different ones. There are others just for the sake of time. And what I want to say about what we're going to show you today is this is not in real time, meaning if you were to do this on your own, the way that you really start to kind of begin to access the release part of fascia, the myofascial release itself, is to be kind of holding or kind of placing pressure on these specific areas for at least 2.5 to 5 minutes. So what we're going to kind of explain to you is we're going to be targeting kind of this different kind of portion of the lower belly for our purposes today. So if you could imagine, it would maybe take you 20 minutes to do the whole belly region. So this is just, I just want to just say that it's not like, oh, you just lay on it for 2 seconds and you're done, even though it can feel intense.
Yeah, think of it like a restorative yoga session, right? Where you're in a pose for 5 to 8 minutes, because that's what really allows the body to sort of open up and relax. And initially when something's painful, realize your body wants to tense up and wants to get you out of pain as soon as possible. So what you really have to opt into, what you have to buy into, is the idea of you stay in this uncomfortable place, but you breathe, and that's going to allow the body to start to relax.
Yeah.
Yes. So
exactly. And this is like such a much bigger subject, really, and hopefully we'll bring in one of our good friends who's an amazing specialist in it, Erica Reed. A little throw out to Erica. But what she's explained to me through this, and again, we'll probably bring her on at some point to really go into it more, is that the body begins to release almost its own natural anti-inflammatory, if you will, only after it's been kind of in this pressure of the myofascial release, I think once you're into the 5-minute range and more. So you can see that it takes some time for the body to really start to release. So anyway, we're going to jump into the demo now. So if you do have fertility balls on hand, please join us as we do this just to kind of feel into it. And you'll just need one for today's purposes. Deborah's going to be my model. She's so good at it. And so I'm going to kind of just back up because she's going to need to lay on the mat. And we're going to start.
Head this way?
Yeah, let's do that. Deborah's going to start by lying on her belly. And she's going to place the fertility ball basically at the right ovary area. So if you locate your frontal hip bone on the right side, you're going to kind of go in toward there. Yep. And then she's going to lay herself down on it. Now, if you've never done anything like this before, I'm just telling you from personal experience, you know, if you're tight in your psoas, which that kind of cuts through that area, or anything like that, or you're dealing with endometrial pain, this might be quite intense. So right now, she's kind of in the starting position. She's up on her forearms, and you can certainly stay there. You can also just, as you start to allow yourself time in this, you may find that you're able to start to come downward, you know, depending on your body, depending on how much time you have. Maybe you have like a thin pillow nearby that you would kind of put, you know, your head on. She's got her forehead down on her hands just so the neck stays kind of neutral. But certainly, like, as you start to get into it, you may find you want to turn your head to one side for several breaths, and then of course you would do the other. But the main thing here is that you want to try to breathe, and it can be quite intense. If you're getting into those kind of trigger points for this myofascial release and some of these more intense areas, breathing can make it more intense, basically. But we're going to encourage you to breathe for a whole lot of reasons. One, it is starting to elicit the relaxation response in the body, which is super important. But it's also going to kind of help you go deeper in this, if you will. So So if you think of, she started here, she's at the right ovary, if you will. If you look down at your own belly, if you're sitting up, and you placed your hand towards your right ovary, and you drew an upside down U, or almost like you're about to draw a square, you would go kind of up on that right side, then you would go across towards your navel. Okay. Then when you would go over the left side, and then you'd go down. So it's basically an upside down U. And that's kind of those points. There's 1, 2, 3, 4, 5, we'll say, for today's purposes, are the points that you would want to kind of hit if you were doing this on your own. You know, if your body allowed it, if time allows. If you only have time for, like, say you only have 10 to 15 minutes, then I would suggest doing the right side, going towards center, and then to the left side, or just right side to left side. But you always do want to go ahead and switch so that you feel balanced. She's going to switch and kind of move just to the left, just for today's purposes of time. But like I'm saying, ideally, you would do that U shape. What I was going to say is that we want to move from right to left because that moves along with the natural energetics of our digestive tract, basically, from ascending to descending colon. So we just want to kind of work with that, not against it. And so,
and you may find that one side is more tender than the other.
Oh, yeah.
Just know that's totally normal.
Yeah, I mean, just in general, even with yoga, even with that type of thing going from side to side, because of our asymmetries, you can start to really notice those imbalances, if you will. And so for sure, you may be noticing, like, wow, you know, this side's way tighter than the other, or what have you. The other thing I just want to mention before she comes out of this, so say that you start at your right ovary, or you start just when you start, or really anywhere in it. If you tend to have back tenderness or anything like a disc issue or something going on with your back, and it starts to feel, like it's aggravating it, or your pelvis feels like it's kind of tilting to one side because the ball is on one side, so there's going to be some imbalance, if you will, to just how level your sacrum is to the floor, like she's kind of tipped this way because the ball is on this side. Just know that you could take a blanket fold or a little corner of a pillow, like in this case she's got the ball on her left side, and she would just take that lift right under the right hip point right here. And so it will take a little bit of pressure off of what she's feeling, but it'll definitely take pressure off of any kind of, if you're having any kind of discomfort in your low back. So I just want to mention that. So for the sake of time today, she's going to start to ease herself out, and she's probably going to bring her hands kind of underneath her shoulders and just push herself right up. Good. Beautiful. How you doing?
Good. You probably want to have more of an empty stomach when you do.
For sure. And probably an empty bladder, just saying. So the next thing that she's going to show is basically a variation of child's pose laying over the ball. And this is something that we teach in the Fertility Ball Method specific to fertility and to the vessel of conception points, and just kind of drawing circulation and blood flow into the belly region. This would, of course, be all of this would be contraindicated if you're on the 2-week wait, or you think you are pregnant, or anything like that. So,
or you're on stimulant.
Yes, or if you're on follicle stem, mostly for follicle stem, because it would be completely uncomfortable. I mean, as it is, it's so just know that. But we're going to do a little bit of a variation. So if you already have the fertility balls and you're like, oh yeah, I've done this before, this is a little bit different variation specific to myofascial release. So Deborah's going to place the ball as we normally would. Oh yeah, and to the right, actually, a little bit to the right. And then she's going to start to lay herself over the ball. So she's basically lengthening her body up and over the ball. And I think I'm going to scooch a little bit so that you have space for your arms. Okay. So again, she's starting on the right side for the same reasons as I had stated before. And what you can start to do here is you can start at center with your arms just reaching at center. If you want to start to kind of change it and perhaps deepen it a little bit, you're going to start to walk your arms over to your left. So it basically is kind of like almost like a lateral stretch, but it's going to kind of move the pressure of where the ball is a little bit and kind of how you're feeling it. Now, if you're someone who, when you get here in this particular variation, your forehead is not easily touching down on the floor, your forehead's like just hanging, your head's hanging, please grab a yoga block or a stack of books or a pillow, a firm pillow, something that would lift your forehead up so that you can release your forehead down onto something, just so that your neck doesn't get tweaked. And then basically from there, she would draw her body back to center, back herself out of the pose enough, however much, to basically readjust the ball to center. And then she would lengthen her body up and over the ball. Now for this one, there's really only about 3 points across that you can really get to. If you were to try to do the upside down U, I find, and it might just be the length of my torso, it starts to push into my rib cage a little bit, so it doesn't feel very good. It feels like it's pushing on bone, not muscle or organs or anything like that. So, but from here, she can stay center, or she can start to come over to the left side again for the lateral stretch. And this is, I'm just kind of telling you like what you could do while you're in it. And of course you would take several rounds of breath. So again, remember, we're staying here for a while if you were actually doing it. And then she could walk herself back to center, maybe take a few breaths to the center, and then she would walk her arms to the right. Since she's at center, now she's just kind of doing that lateral movement here. When she'd be ready to come out of this and do the final step, she'd walk her arms back to center, back herself out of the pose. And you can see she's moving very consciously, which is what we suggest. And then move the ball to the left ovary and kind of lengthen your body up and over it. And certainly, once you get there, you can readjust things if you need to. Now, you can be here at center. Then when you're ready to go lateral, you would go to the right first. And you would be here and you would breathe. And then when you're ready, you'd come back to center. And she's just going to take her time so that she feels balanced too. And then she would go to the left if she wanted to. So that we make that kind of full circle in a way, energetically. And just a quick thing just in general about the Fertility Ball Method, even not related to myofascial release, is that, you know, it has benefits of calming the nervous system, increasing circulation to specific areas of the body, and such. So, and working with the acupressure points for fertility. Go ahead and walk your hands back to center. And when you're ready, walk your hands back. And it's really just, once you come out of any of these, it's a really good idea to really give yourself time to kind of feel, to assess how you're doing. If it felt, you know, say that you had done the full amount of time, say, you know, 10, 20, 25 minutes here, to kind of going through the steps. You know, it'd be great, like, just to be kind of in a neutral position, maybe laying on your back with your knees bent, either with your feet wide and your knees tipping in, just to kind of like let things relax. We call that constructive rest. Or even with support, bringing the soles of your feet together, knees apart, but having a lot of support and just kind of maybe laying on your back like that. Just kind of really just kind of feel anything.
Enjoy the work that you just did.
Exactly. So just making sure if there was anything else I wanted to say before we start to wrap it up.
I think we were going to talk about the idea of good pain versus not good pain.
Yeah, so important. So this is in general with the body, but since we're kind of talking about in the context of endometriosis, and endometriosis in itself can have what is often felt as debilitating pain, where it's hard to kind of stand up straight all the way sometimes. You as an individual need to really tune inward as you get into these. These are intense. I mean, even like when we were practicing this before and I was on it, I mean, I'm just reminded of how much more I need to be doing this. And I don't even have endometriosis. So with that said, we need to tune inward to really ascertain, like, okay, this is intense, but is it breathable? Is it manageable? Mm-hmm. Is it good pain versus not good pain, where your nervous system starts to go into the sympathetic response, which is fight or flight? That's the last thing we want, right? We're trying to kind of tamper all that down and reduce inflammation and just so that's what we've got to kind of figure out. And so just know that especially if you know, you are dealing with a lot of pain, that you might need to prop yourself up so it's not so intense in the beginning, so you can always work your way up. So thank you for joining us, and there's more to come, and we encourage you, if you have your fertility balls, to start to integrate this into your practice. And if you want to learn more about the Fertility Ball Method, you can visit soulfulconceptions.com, and you'll get lots of information on there. We also have on soulfulconceptions.com an opt-in option, if you will, for a free fertility resources library. And even if you're not trying to get pregnant, the resources on there are really for overall well-being as well. So just know that. And yeah, we'll see you on the next round. Namaste.